Hey, it's Dr. Dunaway with Chiro Strength, and today's video is going to be about spine-sparing activities and the context of recovering from low back pain. So the best thing that I can teach someone when it comes to rehab or recovery is how not to hurt themselves after we've tried to correct things either with manual therapy or corrective exercises. Now, these are not major things, it's everyday activities, getting in and out of the car, getting up and down off a chair, tying your shoes, things like that. Those everyday activities have got to be relearned to load the hips and not bend forward and flex from the back. Now there's going to be a few drills I use to kind of teach this idea. The first two are going to be on your hands and knees. The first one's just a simple rocking drill. Trying to make sure we're not flexing from the lumbar spine with a nice good tall chest, looking at a spot 3 to 4 feet in front of us, and being able to do this without having any of that rounding. Now the next one's going to be a simple bird dog. Lock into this same position, slowly start to slide our toes on the ground, lock this leg out, and then barely bring it off the ground. And now I should be able to support that without twisting or leaning over onto my leg. If you want a little more in-depth explanation about the bird dog and how to perform it correctly and all the applications of it, I do have a video on this page that kind of goes over that. But the great thing about that bird dog is that it applies directly to our next drill, which is going to be loading a single hip. And so the reason I load each hip individually is because if we can't load each hip properly, it's going to be really hard in the context of a squat to then have a symmetrical squat that doesn't aggravate one hip or the other. So real simple drill. We start this off just by hinging the hips. I got a slider under my right foot. I'm just going to slide that back. And now this back leg is the exact same position as a bird dog. It's in line with my spine, my glute is engaged, and my knee's locked out. Almost 90% of my weight is on this front leg, and now I'm just going to kind of hang out here. We got to condition the hip to be able to withstand this pressure, or it's going to leak back into the lumbar spine of the knee, and the torso is going to come up. Make sure that torso is forward. And now we're going to do that other side. Same thing. Now once we can load this hip for a good amount of time, 20 to 30 seconds, then we can start working on coordination and working on good rooting strategies of the feet and turning on one leg, continuing to learn how to load this up. Now, obviously, in the context of a squat, we go to double leg now. In the barbell squat or anything like that, we're still loading the hips. Our spine is tilting forward, but still in line. And now I'm looking at a spot 5 to 7 feet in front of me, and I'm not up here looking at the ceiling. If we move from the butt first, and now all of a sudden we're hyperextended and our chest is still up, and we fight to keep that chest up, we're going to be hyperextended the lumbar spine, we're going to hurt that back. So just like we worked with the airplane, it's here and then pull yourself down. In a deadlift, it's back and allow the torso to come forward, keeping nice, good posture. Now in the context of everyday activities, really simple. We talked about loading each hip individually, now we load them both together. Pull ourselves down into the chair. Instead of trying to keep our chest up and prevent we think that leaning forward is bad, so we keep our chest up. Now we load our knees and load our back until we kind of collapse into the chair. Picking something up off the ground. We already have a good single leg deadlift pattern by sliding our legs back or sliding the foot back, and then all we got to do is just lightly kind of hinge at that back knee, bring yourself down, pick something up, and then keep that spine nice and engaged as opposed to kind of coming over like this. The exact same thing can apply to tying your shoes. Really anything throughout the day that you need to bend down for. Got to learn to move from the hips, not the low back, and that will be the #1 key to getting the stage ready to respond well to therapy when recovering from low back pain. So if you have any questions with this, you can always reach me at drdunaway@chirostrength.com. And again, this is Dr. Scott Dunaway with Chiro Strength saying don't just mend, transcend. Thanks.